What about thread veins? How can we treat those? Well, of course, there's camouflage. If you have a scan and it doesn't show very much in the way of reflux and there's no underlying problem, you may be reassured, you may not wish any particular treatment, in which case camouflage is an option. Having said that, most people who get to the stage of seeing us in the clinic want something done about their thread veins. There are electrical treatments like electrolysis. They're particularly good for thread veins on the face. There are treatments that involve putting a laser on the skin. That's not the same as endovenous laser, but you can put a laser on the skin and you can treat those veins on the surface with laser. Again, very good for the face and the chest, but not so good for the leg. And then there are injection treatments. Again, this is sclerotherapy, using a different formulation for thread veins themselves, which is the treatment that's best for legs. This is how we treat thread veins on the legs. We use a very fine needle. We put a medical solution into the thread veins and they fill with sclerosant. They look as if they disappeared because they become clear. Once again, it works by removing the lining of the vein and causing the vein to shrink and collapse. This is a little video clip showing how the injection treatments are done. These are thread veins on the leg that have no reflux, and I'm injecting a medical solution directly into the thread vein. And as you can see, as the clear sclerosant displaces the blood, they look as if they disappear. It works by removing the lining of the vein. It starts a healing process. These thread veins are actually in the skin. They can't be surgically removed or taken away. And a healing process is started, and eventually those veins will disperse and become much less noticeable. This is electrocoagulation, an electrical treatment for thread veins on the nose. We're using a very fine needle and we're applying a medical current to the veins to get them to collapse and disperse. And electrocoagulation is a very effective way of dealing with thread veins on the face. As I've said, I think tests are necessary. The days where you would do surgical stripping by just tapping on the leg or putting rubber bands around the leg are gone. We do need an ultrasound scan. And in our opinion, ultrasound scans should precede the treatment, they should guide the treatment, and they should be performed after the treatment. We can see in this little ultrasound a person who's got floppy valves. These are weak valves that are not meeting properly. And by looking at the flow direction, we can see that blood goes up the leg blue, and this red signal is blood coming down the vein in the wrong direction. Red showing reflux. So we can identify reflux in veins, and we can identify very precisely little areas where reflux are occurring. This is a superficial vein connected to a deep vein, and this is a so-called perforator vein which is not working properly. So ultrasound is very important in identifying where the problem is and where the treatment should be. How can you get treatment? Well, you should be able to get referral according to NICE by going to your doctor and saying, I've got veins and they hurt or they're causing me problems. He may refer you to the NHS or he may refer you privately. Or you increasingly now are doing your own research and you're making your own decisions about who you'd like to go and see. You can certainly refer yourself directly to our clinic. We're happy to receive referrals directly from the public. If you've got a very complicated medical history, we do like some information from your doctor, please. People who are on a lot of medication or who've had a lot of serious illnesses in the past, it's helpful for us to have a medical history and summary, but it's not essential. If you're using private health insurance, you will need a referral letter from your doctor to activate your insurance, usually. And in keeping with good medical practice, if you do come and see us, we like to write to your doctor to keep your doctor informed about the care that we are giving, any advice and diagnoses that we have. And I'm going to show you now just a very brief series of before and after photographs. On the left is the before in all cases, and on the right is the after. This is a lady who had a nasty cluster of spider veins on her nose, treated by electrocoagulation. This is a lady who had quite severe varicose veins in her thigh and calf, treated by radiofrequency ablation venous closure to the refluxing vein in her thigh, and phlebectomy, which is gently extracting the veins. And that's the result of treatment. In all cases, the picture on the right is about 6 to 8 weeks after treatment. And in fact, this is the back of her legs. She had varicose veins, quite severe in both legs. She had both legs treated at the same time under local anaesthetic as a walk-in, walk-out procedure, and that's the result 6 weeks later. Men get varicose veins too, it's not just ladies. This gentleman had quite severe reflux in his thigh, feeding into thigh veins and calf veins. He was treated by radiofrequency ablation. This is a view from the front, these thigh veins and calf veins treated, and 6 weeks later that's the result. Again, this is another man, just to show you that men do get veins as well. This was a member of airline crew, cabin crew, who had a refluxing vein behind his knee, causing quite a nasty little vulnerable bobble there on the back, and he was concerned that it might get injured in the course of his work when he was up in a plane. And there's the back of his leg showing that nasty bobble, and again that's 6 weeks later. This lady has severe reflux in her thigh, causing varicose veins, and I think you can see she's also got some varicose eczema. We treated the reflux and the varicose veins. The reflux has gone, the varicose veins have gone. The skin will improve, but in some cases there is damage beyond repair, and although the varicose eczema may well improve, in some cases it will go completely if it's caught early and it hasn't been present for a long time. If it's been present for a long time and it's very severe, it may not go completely, and the skin, as I say, has been damaged beyond repair. Another series of photographs before and after showing the sorts of results. This was one of the most severe sets of veins we've treated recently. Not surprisingly, it's in a man. When men do eventually come to see us, their veins are usually very severe. They tend to keep them covered under trousers, and when they do eventually come to see us, they're usually quite severe. He had both legs treated, his right leg more severe than the left, both legs treated at the same time in one visit, and that's 6 weeks later. That's the back of his legs there, showing the sorts of results we can achieve in 6 weeks. And some more before and after photographs. Thread veins, now these take longer. Because they're in the skin and because the healing process is slower, you often need more than one injection treatment, and the time scale is longer. So in this case, this is 6 months. Good improvement, but not gone completely. They don't always disperse completely. The costs are covered in the brochure. The brochure is updated from time to time, so if you want to know the current fee scale, do please call the clinic and ask for the current scale of fees. These relate to people who have to pay for themselves, who don't have private health insurance. But we do an initial assessment currently, which includes a full consultation, medical history, and a duplex ultrasound scan for £295. Our scale of fees for foam sclerotherapy and endovenous treatment is also in the brochure and on the website and is updated regularly. However, do please ask for the current fee scale if you're considering any treatment. Certainly when you come for your consultation, you will be given a written quotation for treatment, so you're not committed to anything without knowing the full cost. And that fee will be guaranteed usually for 30 days. As I say, all the costs are in the brochure and they're regularly updated. and they're fully transparent. There's no hidden extras, there's no shocks or surprises. The fees that you're quoted are the fees that you'll pay, and we do offer everything, including all your follow-up, both at 6 weeks and 6 months, any remedial treatment, any unscheduled visits for any problems you might have or any concerns, and if something is not right, in the unlikely event that something's not right, we will see you and put it right for you. The costs of VenaSeal are there, and the costs for thread veins are all in the brochure. If you have private health insurance, you will need a referral from your family doctor usually to activate your insurance. The clinic is fully registered with all the insurance companies. Unless you have a particular excess on your policy, usually the fees are covered in full. Once again, we strongly advise you, and we will help you with making claims with your insurance company. We strongly advise you to get an authorization number and to check your level of cover so that you don't have any nasty shocks in case there's any shortfall in your cover. Why should you see a veins specialist? Well, myself and my team, that's all we do now. We treat people with vein problems, so my team and I get very used and very expert at treating people with vein problems. We're particularly interested in veins. We keep very much up to date. You will have all the treatment options available to you, except surgical stripping, of course. So we don't have just one treatment option that we provide. We can provide all of them. We tailor your treatments according to your requirements and the appearance of your ultrasound scan. And we often add various treatment modalities together to give you the best outcome. So we don't just treat you with one, we may treat your vein problem with one or two different types of treatment to get the best result as quickly as possible with the lowest risk of the vein problem causing trouble again. Our clinic is registered with the Care Quality Commission, which oversees quality. We're registered with all the insurance companies, and we're fully indemnified. No hidden extras, as I've mentioned. The fee that you're quoted will be the fee that you pay. So what should you do now at the end of this talk? Well, I'm going to be available for a little while if you want to come up and ask me a question. Have a chat with your GP. Do take a brochure away, take an information pack away. If you want to make a booking for an appointment today, you're very welcome to. And as I say, we're available for you if you have any questions. Thank you very much for attending this presentation.